Amlodipine is one of the most commonly prescribed blood pressure medications in the world. Over 30 million Americans take amlodipine daily, with the vast majority being adults over 60. This calcium channel blocker effectively lowers blood pressure and reduces cardiovascular risk when used appropriately. However, after age 60, your body processes medications differently than in younger years. Age-related changes in kidney function, liver metabolism, body composition, and drug sensitivity mean that amlodipine can cause side effects in older adults that rarely occur in younger people taking the same medication. According to research from the Journal of the American Geriatric Society, adults over 60 taking amlodipine experience side effects at rates 40 to 60% higher than younger adults on the same medication at identical doses. Some side effects are minor annoyances that affect quality of life. Others are dangerous complications that can lead to falls causing hip fractures, cognitive impairment mistaken for dementia, or even death if not recognized and addressed promptly. What makes this situation particularly concerning is that many doctors don't adequately warn older patients about these age-specific side effects. Patients experience troubling symptoms but don't connect them to their blood pressure medication. They assume the symptoms are just normal aging changes, manifestations of other medical conditions, or side effects of different medications they're taking. Meanwhile, the amlodipine continues causing problems that could be prevented by dose adjustment, medication change, or additional monitoring. In this video, we'll examine 12 side effects of amlodipine that are particularly problematic in people over 60. The first signs relate to swelling and cognitive changes clearly visible in medical illustrations. Number 7 involves effects on brain function and cognition that can be mistaken for dementia or Alzheimer's disease. These aren't rare side effects that happen to 1 in a million people. These are common reactions occurring in 5 to 30% of older adults taking this medication, depending on the dose. Before we begin, understand this information is not telling you to stop your medication. Never stop blood pressure medications suddenly without consulting your doctor, as this can cause dangerous rebound blood pressure spikes leading to stroke or heart attack. Instead, use this information to recognize side effects early and discuss them with your physician. Now let's examine what you need to know about amlodipine after age 60. Side effect number 12. Severe ankle and leg swelling that worsens throughout the day and doesn't resolve overnight. Starting with one of the most common and visible side effects, peripheral edema, or swelling in the ankles, feet, and lower legs, affects 10 to 30% of people over 60 taking amlodipine, depending on the dose. Here's why this happens and why it's significantly worse in older adults. Amlodipine works by relaxing and dilating blood vessels to lower blood pressure. The medication dilates arteries more than veins, creating an imbalance. More blood flows into the legs through dilated arteries, but drainage through veins doesn't increase proportionally. Fluid leaks from capillaries into surrounding tissues, causing visible swelling. After age 60, this swelling is more severe because venous function naturally declines with aging. Valves and leg veins that normally prevent backflow of blood become leaky and incompetent. Calf muscle pump function weakens as muscle mass decreases with sarcopenia. Sitting or standing for prolonged periods becomes more common as activity levels decline. These age-related changes, combined with amlodipine's vasodilatory effects, cause substantial edema that can be quite uncomfortable and functionally limiting. Research from the journal Hypertension examined peripheral edema in older adults taking amlodipine at various doses. Studies found that edema severe enough to cause discomfort, limit mobility, or require treatment occurred in approximately 15 to 20% of adults over 60 taking amlodipine 5 milligrams daily, and 25 to 30% of those taking 10 milligrams daily, the maximum recommended dose. Women experienced higher rates than men. The swelling typically starts gradually over 2 to 4 weeks after beginning amlodipine or increasing the dose. It's usually bilateral, affecting both legs equally, though it can be asymmetric. The swelling is worse at the end of the day after prolonged standing or sitting. The swelling improves somewhat overnight when legs are elevated, but returns the next day. In severe cases, the skin becomes tight and shiny and uncomfortable. Shoes that fit in the morning don't fit by afternoon. Socks leave deep indentations that persist for hours. What makes this swelling particularly problematic in older adults is that it increases fall risk by affecting balance and proprioception. The swollen ankles and feet make walking unsteady because you can't feel the ground properly through swollen tissues. Your gait becomes wider-based and shuffling. Additionally, severe chronic edema can cause skin breakdown, weeping of fluid through the skin, and venous ulcers, especially in people with diabetes, peripheral artery disease, or chronic venous insufficiency. The constant pressure of fluid in tissues impairs healing. What you must do if experiencing significant ankle swelling is discuss with your doctor promptly rather than suffering silently. Options include reducing amlodipine dose to the minimum effective amount, switching to an alternative blood pressure medication that doesn't cause edema, such as ACE inhibitors like lisinopril, ARBs like losartan, or diuretics like hydrochlorothiazide, or adding a second blood pressure medication allowing amlodipine dose reduction. Some doctors add ACE inhibitors or ARBs, which can counteract amlodipine-induced edema through different vascular effects. Self-care measures including elevation of legs above heart level for 30 minutes several times daily, compression stockings with 20 to 30 millimeters mercury pressure worn during the day, and reducing dietary salt intake provide modest benefit but rarely resolve the swelling completely if amlodipine dose isn't adjusted. Side effect number 11, excessive fatigue and weakness interfering with daily activities and quality of life. Moving to a side effect often dismissed as normal aging, amlodipine can cause profound fatigue in older adults that substantially impairs quality of life and functional independence. Here's the mechanism. Amlodipine lowers blood pressure, which is the desired therapeutic effect. However, if blood pressure drops too low for an individual's physiology, blood flow to muscles and organs becomes inadequate to meet their metabolic needs. You feel tired, weak, and lacking energy, even with minimal exertion. Additionally, amlodipine affects calcium channels not just in blood vessels, but also in muscle cells throughout the body. Calcium is essential for muscle contraction, force generation, and energy production at the cellular level. By blocking calcium channels, amlodipine may impair muscle function directly, contributing to weakness and easy fatigability that goes beyond just low blood pressure effects. Research from the American Journal of Cardiology examined fatigue as a side effect of calcium channel blockers in older adults. Studies found that moderate to severe fatigue occurred in approximately 8 to 12% of adults over 60 taking amlodipine. The fatigue was substantial enough to limit physical activity, reduce quality of life, cause social withdrawal and isolation, and cause some patients to stop their medication without telling their doctors, creating dangerous blood pressure control gaps. The fatigue from amlodipine is typically constant throughout the day rather than improving meaningfully after rest or sleep. Activities that were previously manageable become exhausting. You might need to rest after showering or preparing simple meals. Exercise tolerance decreases noticeably. Walking distances that were easy before now leave you breathless and tired. Climbing stairs becomes difficult or impossible. What distinguishes amlodipine-related fatigue from fatigue due to other causes is timing and onset pattern. If fatigue began or worsened noticeably within 2 to 6 weeks of starting amlodipine or increasing the dose, the medication is likely responsible. If fatigue has been present for years before starting amlodipine, other causes, including anemia, thyroid disease, heart failure, depression, or sleep disorders, are more likely culprits. What you must do is have your blood pressure checked carefully while experiencing fatigue to determine if it's too low. Bring a blood pressure log with readings taken at different times of day to your doctor appointment. If blood pressure is consistently below 110/70 millimeters of mercury, or if you have symptoms of low blood pressure, including lightheadedness upon standing, blurred vision, or difficulty concentrating, your amlodipine dose may be too high for your individual physiology. Discuss dose reduction or switching medications with your doctor. Blood pressure targets in adults over 65 are slightly higher than in younger adults, typically less than 130/80 millimeters of mercury, but not excessively low, as very low pressure causes more harm than benefit in older adults through reduced organ perfusion. Side effect number 10, dizziness and lightheadedness increasing fall risk dramatically. Dizziness is a serious side effect in older adults because it directly increases fall risk, and falls in people over 60 cause devastating consequences. Here's why amlodipine causes dizziness. By lowering blood pressure, especially when changing positions from lying or sitting to standing, amlodipine can cause orthostatic hypotension. Blood pressure drops suddenly upon standing, reducing blood flow to the brain temporarily, causing dizziness, lightheadedness, visual blurring, or even fainting called syncope. Additionally, if amlodipine lowers blood pressure too much overall throughout the day, even without position changes, you may feel dizzy or unsteady because brain blood flow is marginally inadequate for optimal neurological function. Research from JAMA Internal Medicine examined medication-related falls in older adults. Studies found that calcium channel blockers, including amlodipine, increased fall risk by approximately 30% to 40% compared to people not taking these medications. Falls in people over 60 cause devastating consequences, including hip fractures requiring major surgery, traumatic brain injuries causing permanent disability or death, vertebral compression fractures causing chronic pain, loss of independence requiring nursing home placement, and fear of falling causing self-restriction of activities and social isolation. Amlodipine-related dizziness typically occurs at predictable times. It's worse within 1 to 2 hours after taking the medication as blood levels peak, when standing up quickly after sitting or lying down for extended periods, in situations where blood pressure naturally drops, such as after large meals when blood is diverted to the digestive system, in hot weather causing vasodilation, after warm showers or baths, or when dehydrated. What makes dizziness particularly dangerous is that older adults have multiple fall risk factors already present: reduced muscle strength from sarcopenia, impaired balance from vestibular system decline, vision problems from cataracts or macular degeneration, peripheral neuropathy from diabetes reducing sensation in feet, slower reflexes from aging, and other medications including sedatives, anticholinergics, and antidepressants all combine with amlodipine to create very high cumulative fall risk. What you must do with experiencing dizziness is implement fall prevention strategies immediately. Stand up slowly in stages. When getting out of bed, first sit on the edge for 30 to 60 seconds before standing. When rising from chairs, pause before walking. Use grab bars in bathrooms, near toilets, and in showers. Ensure adequate lighting throughout your home, especially at night with night lights. Side effect number 9. Flushing and feeling excessively hot, especially in face and neck. Flushing, sudden redness and warmth of the face and neck, occurs because amlodipine dilates blood vessels, including those in facial skin. Blood flow to facial skin increases, causing visible redness and uncomfortable sensation of heat. This affects 3 to 5% of people taking amlodipine and is more bothersome in older adults who already experience temperature regulation changes with aging, making them more sensitive to feeling too hot or too cold. The flushing typically comes in episodes lasting 5 to 30 minutes, occurring unpredictably throughout the day or triggered by warm environments, alcohol consumption, spicy foods, hot beverages, or emotional stress. While not medically dangerous, it's embarrassing in social situations and uncomfortable, causing some patients to discontinue medication without medical supervision. What you can do is avoid known triggers, including alcohol, spicy foods, hot beverages, and overheated environments. Dress in layers you can remove easily. Use fans to stay cool. Keep rooms well ventilated. Discuss with your doctor whether switching to an alternative blood pressure medication would be appropriate if flushing significantly affects quality of life or causes social withdrawal. Side effect number 8. Palpitations and irregular heartbeat sensations. Some people taking amlodipine experience palpitations, uncomfortable awareness of their heartbeat, or sensations of skipped beats, extra beats, or racing heart. Here's the mechanism. Amlodipine's vasodilation and blood pressure lowering triggers reflex tachycardia through baroreceptor activation. When blood pressure drops, your body's autonomic nervous system compensates by increasing heart rate to maintain adequate cardiac output. Additionally, amlodipine can unmask or worsen existing arrhythmias in susceptible individuals. Research shows that new-onset palpitations occur in 2 to 4% of adults starting amlodipine. While often benign, representing sinus tachycardia or isolated premature beats, palpitations warrant evaluation because they can indicate atrial fibrillation or other significant arrhythmias, especially in people over 60 who have higher baseline arrhythmia risk from age-related cardiac changes, including atrial enlargement and fibrosis. What you must do if experiencing frequent palpitations is notify your doctor promptly. You may need electrocardiogram monitoring with Holter monitor, worn for 24 to 48 hours, or a vent recorder worn for weeks to determine if significant arrhythmias are present. If only sinus tachycardia is found, dose reduction may eliminate palpitations. If atrial fibrillation is discovered, anticoagulation with blood thinners to prevent stroke becomes necessary regardless of amlodipine adjustment. Side effect number 7. Cognitive impairment, including memory problems, confusion, and slowed thinking that mimics dementia. This is a side effect most often missed because it develops gradually and mimics dementia or normal cognitive aging. Here's why amlodipine affects cognition. If amlodipine lowers blood pressure excessively for an individual, chronic cerebral hypoperfusion occurs. Your brain doesn't receive adequate blood flow continuously. The brain is extremely sensitive to blood flow changes, requiring approximately 15 to 20% of cardiac output despite being only 2% of body weight. Even modest reductions in cerebral perfusion pressure impair neuronal function. Over weeks to months, this causes noticeable cognitive impairment. Additionally, some research suggests calcium channel blockers may directly affect calcium signaling in neurons, potentially impairing synaptic function, neurotransmitter release, long-term potentiation necessary for memory formation, and neuronal plasticity independent of blood pressure effects. Research from the journal Hypertension examined cognitive effects of blood pressure medications in older adults. Studies found that excessive blood pressure lowering, defined as reducing systolic pressure below 110 mmHg in adults over 70, associated with increased cognitive decline, faster progression of white matter hyperintensities on brain MRI, indicating small vessel disease, and, paradoxically, increased dementia risk. The brain requires adequate perfusion pressure to function optimally. Too much blood pressure lowering causes more harm than benefit. Symptoms of amlodipine-related cognitive impairment include difficulty concentrating on tasks or conversations, slowed thinking and processing speed making conversations harder to follow, memory problems, particularly for recent events and conversations, word-finding difficulty, searching for common words mid-sentence, and mild confusion or disorientation about time, date, or familiar locations. Family members may notice the person seems not quite right, foggy, mentally slower, or just not themselves. What makes this particularly insidious is the gradual onset. The cognitive changes develop over weeks to months, so slowly that neither patient nor family connects them to the medication started months ago. The person may be worked up extensively for dementia, undergo brain MRI and neuropsychological testing, and be given provisional Alzheimer's disease or vascular dementia diagnoses when the actual cause is medication-induced reversible cognitive impairment that would resolve with dose adjustment. Side effect number 6, severe headaches that don't respond well to usual pain relievers. Amlodipine can cause persistent headaches through vasodilation of cerebral blood vessels. The dilated vessels stretch pain-sensitive structures and trigger pain receptors, causing headaches. This affects approximately 5% to 10% of people starting amlodipine. The headaches are typically bilateral, affecting both sides of the head, described as throbbing or pressure-like sensation, and may worsen within 1 to 2 hours of taking the daily dose as drug levels peak. Most amlodipine-related headaches improve over 2 to 4 weeks as the body adjusts to the medication. However, some people continue experiencing daily or frequent headaches that significantly impact quality of life and ability to function normally. What you can do is try taking amlodipine at bedtime rather than morning, so any headache occurs during sleep. Ensure adequate hydration, drinking at least 8 cups of fluids daily. If headaches persist beyond 4 weeks or are severe, discuss dose reduction or alternative medications with your doctor. Don't suffer silently with daily headaches, assuming they're unrelated to your medication. Side effect number 5, chest pain or discomfort that feels like angina. Paradoxically, amlodipine prescribed specifically to prevent chest pain can occasionally cause chest discomfort. This occurs in less than 2% of patients, but is concerning when it happens. The mechanism isn't fully understood, but may relate to reflex tachycardia, increasing myocardial oxygen demand, or changes in coronary blood flow distribution. Any new or worsening chest pain requires immediate medical evaluation to rule out heart attack or unstable angina. Side effect number 4, gastrointestinal symptoms, including nausea and abdominal discomfort. Amlodipine can cause nausea, abdominal pain, and other digestive symptoms in 2 to 5% of users. Taking amlodipine with food may reduce nausea. Side effect number 3, muscle cramps and muscle pain, especially in legs at night. Muscle cramps affect 1 to 2% of people taking amlodipine. Ensure adequate hydration and stretch before bed. Side effect number 2, gum overgrowth, called gingival hyperplasia. This affects 1 to 3% of long-term users. Meticulous oral hygiene and regular dental cleanings help prevent it. Side effect number 1, dangerous interactions with other medications. Amlodipine is metabolized by liver enzyme CYP3A4. Many medications inhibit this enzyme, causing dangerous interactions. Avoid grapefruit completely. Inform all doctors you take amlodipine before starting new medications. Which side effects surprised you most? Are you taking amlodipine? Share in comments. If this helps you, please share and subscribe for more evidence-based health content.